My name again is Allison LaFerlita. I am the Executive Director with the Nonprofit Resource Hub. For those of you that don't know what we do, we are a nonprofit association that provides support services and education to the nonprofit sector. We want a one-stop shop for our nonprofits to be able to come and find resources, to find educational opportunities like this, to keep our nonprofits informed of what's going on in this very fast-paced, ever-changing world. And if you are not a member and you're a nonprofit, it is free to join. This is a no-brainer. I would recommend that everybody get on and join. You will always be kept in the loop of what we're doing. You will be invited to our events. And if you ever need support, you know you're always welcome to reach out to us. So please do consider joining if you are not yet a member. I would like to introduce you to our speaker today, Ed Probst. He's the president of Vanguard Benefits. He is going to be talking to you and with you about designing an impactful corporate wellness plan for your nonprofit. So he'll cover reducing your benefit costs. He's going to cover boosting recruitment and retention, combating workplace stress, and scalable solutions for all nonprofits. We know that this is something that many in the sector do have a challenge with, and Ed is here to help you sort through it and be of service and support to you as you make your decisions. So without further ado, I would like to welcome Ed Probst.
Thanks, Allison. Good afternoon, everyone. As Allison said, my name is Ed Probst. I am founding partner and president of Vanguard Benefits. I have been in the employee benefits space for 25 years now. So today's presentation is called Designing an Impactful Corporate Wellness Plan for Your Nonprofit Success. I'm going to give you my lens from both an employer and employee perspective on wellness programs, from the thousands of employee interviews we've done over the years, from the clients that we've worked with over the years, and what they've done in the past and what they're doing now. I think I can give you an important lens, but I'd like to keep this very interactive. So at the very least, feel free to type your questions in the chat. If you'd like to come off and present yourself and vocalize your questions, I'm happy to take those along the way. And I'm also interested to hear more about what you're doing in your organization that's working, because I think that could spark a lot of great conversation and be very helpful for the other participants of our webinar. I apologize if my voice is a little froggy this morning, but we were at the Met game last night with my son. Hopefully we have some fellow Met fans here today, and you'll understand where I'm coming from, but very exciting night. So to move forward, want to talk to you a little bit about corporate wellness and how it's evolved over the years. And it's evolved in both the types of wellness programs that are out there, what they expand to and touch on, and also in the way that employers view, nonprofits view, the importance of wellness in the workplace. It's no longer seen as a nice to have. It's more seen as a necessity now than ever before, from a perspective of recruiting, from retention, how it assists with benefit costs and things of that nature. And we'll try to touch on a lot of that today and give you some overview of what others are doing. A strong wellness program can lead to up to 72% reduction in absenteeism and overall 29% increase in productivity. So it can definitely move the needle when it comes to important items in any nonprofit organization. And it's not just a perk anymore; it's more of a necessary benefit that our employees are looking for, and it touches on most employees' lives. And there are many different types of wellness programs that you can offer. I think in the past, it sounds like, not only from a perspective of a nonprofit that is juggling a lot of items or swords in their day, to add something else to it seems like, well, it better be really impactful if I'm going to do something like this. But I think when you see what we talk about today and some of the examples we provide, you'll see that it can be budget friendly, and there are things that you can do that make an impact in your organization right away that don't cost anything at all. and can be very simple to manage. So with that, we're going to move on and start talking about corporate wellness. And again, like I said, if you have any questions, feel free to type them in the chat or come off mute and ask them. Okay, so why are employers interested in offering corporate wellness programs, right? So there's 4 key areas we have up here that are very important to any organization. One is reducing healthcare costs. Now, that can be a very challenging area, and it doesn't impact all size organizations the same way. If you're a small organization, especially if you're in the New York area where it's community rated, you might not see any impact on your health insurance costs at all. It's more of a global type of benefit where it helps the overall population of employees from many employers, but not necessarily are you going to see the impact on your own organization right away. If you're a larger employer and have over 100 employees, you might start to see some benefits and reduction in benefit costs with a consistent wellness program that is offered for years. And again, that really depends on size as well. If you're around 100 employees where you're not getting a lot of transparency with claims, you might be able to see that impact over several years and be able to just see it in your rate increases over the years, or your maybe perhaps decreases, which doesn't happen all the time, but you might be able to see that it's just going to take longer because you're not going to really have the data to make decisions. If you're a larger organization, let's say 150 to 200 plus employees in your plan, you're going to get actionable data that you can see. You won't get real benefits in real time, meaning that if you initiate a wellness plan that drives down claims costs today, you're not necessarily going to see that in your premiums tomorrow, because when you negotiate your health insurance premiums, it's on an annual basis, and that doesn't change to the following year. However, you're going to be able to see what is going on in your claims and be able to make decisions that can possibly impact them, such as telehealth or emergency room education on how to stay out of the emergency room, or things of that nature, prescription drugs and education on prescription drugs or generic alternatives. Things like that can drive the needle, move the needle. But again, like I said, it won't happen in real time, but you will be able to see it. And of course, if you're self-insured and you have a self-insured program, that will give you ultimate transparency to be able to see what is going on in your experience, how wellness programs are making an impact on a day-to-day basis. But you'll also be able to initiate some wellness programs that might make an impact in real time. So that is something that if you are large enough and you are self-insured, you can really make a difference in your overall healthcare costs. Increasing productivity. I think that all of us can relate to being burned out at work, or not feeling rested or physically active, and how that impacts you in the workplace. And when you're not at your best, productivity suffers. So if your culture is one where it's not fostering a culture of well-being for your employees, you're going to see a lack of productivity. And you can also gauge that if you're seeing more productiveness because you're starting to initiate things that are helping your employees promote well-being. Improved employee engagement, retention, right? So corporate wellness initiatives demonstrate to the employees that you care about them, that you're creating an environment that is a place where they can feel not as stressed, not as burdened, and not overworked. And by doing so, that is definitely going to enhance with retention on a long-term basis, and it enhances your company. So from a branding perspective, potential recruits in a very, and today being a very challenging recruiting market, they are looking at your social media, they are looking at your websites, they're talking to your employees prospectively, but they're looking at what that culture looks like. And if that culture is one that exhibits to the public that there are people that are happier, that have work-life balance, that are taking part of initiatives that get them healthier, both mentally and physically, that's going to be attractive to potential recruits and enhances your company brand. And a 2024 Wellable survey showed that 44% of employers in 2024 are going to be more engaged in offering wellness initiatives to their employees. So definitely something that is growing and something that nonprofits will be looking more to enhance their workforce. So some of the key components of a successful program, you want to have a holistic approach. So it's got to be comprehensive. It's got to cover a lot of different areas of employee well-being. Of course, nutrition programming, whether that be educational or cooking classes or just having healthier snacks in the workplace, but promoting nutritional health for your employees is definitely part of that initiative. You want to also have a physical component of it. Physical component can be anything from gym memberships. It could be walkathons or promoting walk challenges and things like that in the workplace. I know, in our building, like we go out to lunch sometimes, and in the hallway, you'll see, literally 5 or 10 people walking through the hallway, counting their steps every day. And, if employers are promoting that, it promotes physical fitness. And again, this is all relative because physical fitness leads to mental fitness and overall well-being. Mental health, as we touch on it, mental health is a critical issue to this. One of the things that we've seen over the years is the stigma that is associated with mental health, thankfully, is starting to eradicate, and more people are open-minded to discuss their needs for mental health and they're actually looking to their employers for resources that can support their mental health. And I think that's something that, whether it be stress reduction programs or EAP programs or just, communication, an open line of communication in the workplace and making an employee feel welcome to discuss, challenges they have and how they're being impacted at work is important to the overall component of a successful wellness program. Financial wellness is obviously part of this as well. And providing resources to your employees that promote financial wellness, so that we know financial wellness can lead to positive mental experiences and overall well-being. And then work-life balance, whether that be hybrid work schedules or flexibility in the workplace, that is all part of that holistic approach. So a combination of all that you can draw from a lot of different resources that are out there is what is necessary to create that successful program. Of course, it's got to be a top-down approach. So if a program is going to be successful, employees got to see that leaders, managers, upper-level managers, and the key C-level managers of organizations should be really involved in it. And we find that over the years that if they're involved in it, all employees will get more involved in it. And if they see other employees that are engaged in these type of wellness programs, it leads to more engagement overall. It should be inclusive, of course, from a diversity standpoint. It should include all ethnicities, genders, neurodiversity. It should be all in there. So everybody should be able to take advantage of these if they want to, of all abilities and capabilities. So something that is important to any program. Data-driven decision-making. You want, as you're designing your wellness program, you want to make sure that you have goals that you are setting for the programs that you can track over a course of time to evaluate what's working and what's not working, and then use that data to make changes to your wellness program or enhancements. Recognition is a big component of it. Incentives, gift cards go a long way. I always say that. Or recognition in the workplace for challenges that have been set by an employer, or just for engagement in a wellness program that was initiated by an employer, that's very important to it. And then your communication is everything. So many employers that we work with over the years have had access to wellness initiatives and programs that were even offered by carriers they were using, insurance carriers they were using, or even just local businesses in the community. And if you don't effectively communicate that, promote it through various channels like social media and website and email and and word of mouth, if you're not communicating that and educating the employees on it, the chances of them using it and it becoming effective is probably not that good. So it's important that during open enrollment and throughout the year that there's constant communication and promotion of these events, and it's showing not only to your employees but to your recruits and your candidates that you are engaged in your employees and that you care about their overall well-being. So talking about how would you implement a wellness program, I think that every organization is different, and you need to understand what is needed by your organization, what's more important, because starting a wellness program might be a little overwhelming to, we talked about nutrition, we talked about mental health and physical, financial, and to throw that all out at one time, if you're just getting started with a wellness program, might be a lot. For both you to manage and for employees to digest and engage with. So it starts with something and can lead to more. But I think the first thing is assessing your organizational needs and knowing what's important. What are your employees struggling with right now? If it's mental health, maybe more focus on employee burnout and stress would be important. If you have employees that are struggling with physical activity and not able to do it on their own, maybe a physical fitness program would be a great start. And then, but the way to do that is to assess your organizational needs through surveys and conversation with your employees so that you know where to start. Establishing a wellness committee, whether that be 2 people or a dozen, is always a good idea. If you can get a couple of people in your organization that are really sold out to wellness and really want to make a difference in the employee and have them start a committee, it's ideal if that committee could include an upper level manager or the leader of the organization that sits on that committee. We have clients that the executive directors are on the wellness committees and they do attend the meetings just to show that they're engaged and know the importance of it. So through that committee, it helps with setting the goals and setting a strategic plan, and a strategic plan that has, actionable items, activities, timelines, and measurable outcomes that you're looking to achieve is really important so that you can track and see where you're at with hitting your goals. It should offer a variety of programs and incentives, anything from educational incentives, or educational programs, which could be anything from periodicals, reading, online videos that they can access, employees can access. It could be lunch and learns that are topical about different wellness types of initiatives. Some of our clients, we bring in outside providers. They can be clinical providers through local hospitals or doctors that are willing to give education on diabetes or hypertension or heart disease, anything that you can get. There's plenty of providers in the communities that you can access that have knowledge about certain things like nutritional programs or just physical activity and stress that you can draw from that don't cost you anything to talk to your employees about this, and to do a lunch and learn and have an incentive that entices employees to participate and engage in that lunch and learn goes a long way over the course of time as you're rolling out your wellness program. As we talked about, you want to foster support from your leadership, so it's important that the high level managers are involved. You want to communicate these. You may want to communicate this in your benefit administration systems, on your company intranet, any of your emails, email blasts, but whatever is the most important. A lot of our employers engage with their employees through text communications, and by doing so, they're able to get to them in the form of media that they use the most, and therefore get more engaged employees. And of course, you have to be nimble when it comes to a wellness program. Not everything is going to work for every organization the same way. Every organization will be impacted differently and have different needs. So it's important to evaluate it along the way and make adjustments as you see fit to make sure that you're impacting the employees that need it the most. Education is critical, and I touched on this. Oops, sorry about that. I touched on this a little bit already, but in any employee benefit program, education is critical. Employees that are educated on their benefits, they're equipped with more knowledge. They make healthier lifestyle decisions. They make better decisions about their benefits that support their lifestyle, and that in turn can lead to more productivity and less absenteeism and less chronic illness that helps them in the workplace. So education is critical, and as I said, it could be lunch and learns in the workplace. It could be during open enrollment, having a proactive strategy where you have educational counselors that are meeting with employees one-on-one, not only to provide them with the core benefits that they're being offered, but also the ancillary benefits that go along with that and some of the value-added types of benefits that promote well-being. So if there's a lot of times we see that employees don't use benefits that they have access to because they never knew about it. So education is critical. It'll increase participation. The more you educate them on wellness initiatives, the more they're going to use it. And the more they use it, the more it fosters behavioral changes. As we talked about, workshops, seminars, digital workshops. So, we've done both online Zoom sessions for employees. We've done digital type of webinars. We've also done in-person webinars where we've come on site and educated and brought in outside partners to educate on different topics because you want to build a health conscious culture. And the more you're engaging your employees to participate in these programs, the more health conscious they will become. The word spreads. And if you are if you're having challenges or just overall contests in the workplace and things like that nature, it helps promote it. It helps employees talk to one another and they become more educated. What are some of the preventive measures we can focus on when it comes to promoting wellness in the workplace? So here's some preventive strategies that you can use. Some of them may have costs associated with them, and some of them you might be able to access through, like I said, local providers, or you might be able to access through your insurance carrier partners. Biometric screenings are something that can promote wellness in the workplace. So having employees do lab work and through biometric screenings, having providers that will do that for them, to do blood screenings for hypertension, for cholesterol levels, for diabetes, all that stuff, and then having programs to assess that and multiple touch points, meaning that if this is done on a semi-annually or annually, or even if you want to do more frequently, but I would say semi-annually or annually, employees can start to see the impact of some of the programs that you're using and how that's helping them with their biometrics. Preventive health exams. So there's plenty of providers that will do preventive health exams that go along with these biometric screenings. They can do cancer screenings. You can do annual physicals. Just promoting in your as you may know, all health insurance plans that are qualified under the Affordable Care Act all cover preventive care at no cost. We still find in our education sessions that employees don't even know that, which is hard to believe because we're 14 years in, but it's true that some don't understand that. So even just from an educational standpoint, that doesn't cost an employer anything, promoting the fact that you can go for your annual physical and every year that won't cost you anything. It'll be no copay. So by doing so, again, employees that are starting now to take care of themselves by getting their annual physical and their preventive exams, are starting to find out if there's anything ongoing inside of them that could lead to chronic disease. Overall, that's going to help them. It's going to help the company with reducing benefit costs if you're large enough that makes an impact, but it's also going to help you from a productivity standpoint because healthier employees are going to come to work more often. So just educating employees that this benefit exists, or even creating an incentive that will promote employees to go get their annual physicals. I know if you have, a voluntary benefit like Aflac pays employees for getting their annual physical. So if you get your annual physical, they give you a cash payment for getting that annual physical. Nutrition and exercise programs. We talked about this already, but setting up a nutritional class, setting up healthy snacks in the workplace or educational workshops, all of that are preventive before your employees get to a point where they have a chronic disease. Stress management, something very important that I would say now is probably the thing that we're asked most about. Mental health in the workplace, as I said before, is not any longer something that is stigmatized. It's something that employees, for the most part, are looking for resources from their employer in order to access their mental health services. So whether that be, insurance plans that offer an access to robust panels of mental health providers, or it's an EAP program, or it could be a stress program in the workplace. All of that stuff is very important to the employer, because from a mental health perspective, we know that mental health that's left untreated can cause chronic disease. It could cause burnout in the workplace, and obviously can lead to not only just lack of productivity in the workplace, but it could lead to very serious mental or health challenges for employees if it's left untreated. So stress management in the workplace is something that we're seeing much more than ever before. We have clients that have even, because some mental health providers, and it's something that is still a challenge, where some mental health providers do not participate in any health insurance panel. So it is, and we're aware of that it's can be difficult to find a mental health provider at times, even if you have a robust health insurance network. Some providers, some organizations that we work with have actually contracted with local mental health providers to offer a discount to their employees that go to see them. So they leave it as a resource. It's anonymous, but if they identify themselves as coming from that organization, the mental health provider will provide a discount. So it's affordable for the employees. So again, something that doesn't cost the employer anything, but is a valuable resource to the employees. And of course, smoking cessation programs. Insurance carriers offer smoking cessation programs. Not all of them do, but a lot of them do offer it. So you can promote their programs to help your employees with smoking cessation, and obviously that over a long term will make an impact on their health. And there are more robust smoking cessation support systems that you can provide to your employees that might have a cost to them. But again, the long run is very impactful when you're driving down the amount of employees that are actually smoking. So some of this we talked about already, but incentive programs, as you're implementing it, what will make it most impactful? Incentive programs, like I said before, gift cards, discounted memberships, anything like that goes a long way to engage participation, enhance participation. Wellness challenges, whether it be a weight loss challenge, it could be a step challenge, or an encouragement to be more physically fit and attend physical fitness facilities, things like that. That all can be impactful. some organizations might have the ability to do an on-site physical fitness facility. So if you do, obviously, we do have some clients that have put this in their workplace, or they work in, or they lease space in buildings that have gyms and physical fitness facilities. If you do, great. That makes it even easier for you to provide a resource for employees where, maybe during their lunch or after work or before work, they can go in and exercise on site, and you're making it easier for them to do that. It's understandable that not all organizations are going to have the ability to do that. However, you can make, as we talked about before, relationships and partnerships with local fitness facilities that might offer a deep discount or give some kind of discount or free service for employees to come to their fitness facility. So that's one way you can do that. Or even if you just have a room that employees can go to do exercise or meditation or things of that nature. One thing that we work with a company called On the Mark Fitness, and On the Mark Fitness provides an app for employees where they can access all types of physical fitness activities and how to do them for varying different parts of the day, whether they're sitting at their desk or they have 15 minutes break, or they have a lunch break, or they have a little time after work before they, before they sleep. All of that, different ways, but it's making it easy on people to become physically fit. Because the one thing about becoming physically fit is that we all have busy lives, and where we live is ultra fast paced, and is hard to find time to focus on yourself. But I think the thought process is, as something similar to what I said before about taking on too many wellness programs at once. Some people think that I don't have the time to do an hour of exercise every day. But if you're not doing anything and you get to 5 minutes a day, and then maybe 10 minutes a day, anything you do is going to be better than doing nothing, right? So if, as an employer, you're making this easy for them to do that 5 or 10 minutes a day, that's going to go a long way. We talked about nutritional education and providing healthy snacks and cooking classes in the workplace. Mindfulness, we have employers that are doing full stress mastery programs where they are working with upper level management to train them on how to recognize burnout and help employees that are going through burnout to more robust programs where they are providing a survey for employees to gauge what is stressing them out, and then using that data to provide educational services that on a regular basis that help employees with stress in the workplace, to employers that have rooms that have, that are conducive for meditation and mindfulness, to employers that do guided meditation, even during COVID on Zoom, but can encourage employees to go into rooms to do group meditation and have classes like that. All of that, I think, is extremely important. And mental health, as I said before, is a big part of that. And then from a work-life balance standpoint, flexible work arrangements, understanding the employees' needs and what employees' home life is like when they leave your employment is extremely important, whether that be, providing resources for them, for their children, providing resources for them that give them a remote work schedule or a flexible schedule of some sorts. All of that goes a long way in helping them become, have a feeling of presence and well-being. So the World Health Organization did a study in that the mental health conditions of the global economy cost $1 trillion each year in lost productivity. 1 in 5 adults experience mental health issues each year. 67% of all employees surveyed report symptoms of burnout in the workplace. Again, a lot of this was accelerated during COVID, and I think it's more prevalent now than ever before. 50% of managers feel uncomfortable discussing mental health, and that's understandable, and that comes into when we talked about before. If you want to start somewhere and you're training your upper level managers, not only to how to recognize burnout, but how to proactively help their employees not become burnt out, and what to do about it if they are, that can go a long way in creating a great culture in your organization. 90% of employees say mental health benefits are important. I can't stress that enough. When we do one-on-one sessions, our organization has always been big on proactive education, which means that we educate the employees of our employers and nonprofits, one employee at a time. We promote that one-on-one educational approach. I will testify to that over the years, we have seen the number one thing that we've been asked about by far is mental health resources, whether that be what EAP programs are available to me, what doctors can I see, or what medications are covered. And the younger generation has become way more comfortable with this, which is a great thing than before. The younger workforce right now they feel it's the obligation of their employer to make sure that their mental health is a top priority. And so this is something that we've seen grow and evolve by leaps and bounds over the years. And the average cost nationally for employees with untreated mental illness is about $4,683. So mental health is a critical component to your wellness program. I would argue that if you're going to start somewhere, that might be a great place to start. And we talked about a lot of this already. But the one thing I'll throw into is, you can create a mental health awareness campaign. You can tie that in with mental health, the mental health awareness months that are on the calendar. And you can, start with some kind of campaign that promotes well-being and shows your employers that you're committed to helping them with their mental health. How do you measure success? And we talked about a little bit about this before. In the past, when we spoke to employers, because we're talking about their benefits, when we spoke to employers about wellness, the biggest question we got was, well, how's this going to help me lower my health insurance costs? Or how's this going to help me lower my workers' comp costs? Things of that nature. And that's still true to some degree, where we definitely want to know if that's making an impact. And I would say the number is about 17% over time, not in any one year, but if you can make a dent in your healthcare costs by 17%, I think you're looking at a program that's been very successful. We have clients, especially those that are self-insured, that have over a 2 to 3 year period, by implementing various levels of wellness programs, have been able to decrease their costs. And not only that, I've seen things that they have done that have made immediate impacts. If you're reducing your absenteeism by 25% or more, you will judge that as a successful program. If you can get 55% of your employees engaged in wellness initiatives in some capacity, that will lead to a successful program. And if you can do health risk assessments where you can ask employees and you can get them to participate in risk assessments to show what is really their greatest risk, and then design your programs around that, that will lead to a successful program. And that's according to SHRM. I want to go into some more about the certain things, the metrics you can be looking to determine whether your program is successful. Obviously, we talked about the participation rate in any wellness program. So, if you're taking the overall employees divided by the number of employees that are participating, and that number is increasing, we're looking at that. You can compare biometric screenings to see, what impacts were made. Are we getting people that are off medications? Are we getting people that have lowered their BMI or their cholesterol and blood pressure? Things like that. Of course, if you're seeing a real hard dollars in your health cost savings, that's going to go a long way in measuring the program. I would say that, For most, that's going to take time to do, unless you're self-insured, where you can see that start to hit pretty quickly. But it is something that's measurable and that you can look at over the course of years. Of course, employee satisfaction, constantly surveying, understanding from employees what's working, what's not working is going to give you a good idea of what you should focus on in the future. If nobody's taking advantage of the nutrition class, but 50% of your employees are now exercising or meditating, you're going to know that those are the programs that you should invest in and provide a lot of support in. And then productivity gains. Are your employees showing up for work more, taking less sick days? Is your productivity levels increasing? All of that are valuable metrics that you can use to evaluate your program. Talk real quick, as I mentioned self-insured a few times, just talking about fully insured versus self-insured and just some numbers. From a medical insurance program perspective, this is information that came from Kaiser in 2023, but the average self-insured plan costs about $7,900 per employee, whereas a fully insured plan is $1,000 more, and corporate wellness programs cost employers on average of about $762 per employee per year, if you're engaged in a full wellness program. As I said, there's plenty of things you can do that don't cost anything. A little bit about the difference between self-insured and fully insured. Obviously, and I'll go through this quick, it offers financial incentives. It gives you the ability to impact cost in real time. You have more control over your costs, you have more data, and you have the ability to enact cost reduction strategies that can help. You have more control and customization, so you're able to design plans that are more customized and fit the needs of your employees. You have more data to utilize. You can measure health outcomes. It has longer term benefits as you start to understand your population, what works, what doesn't work, and you're helping drive down costs. The benefits, the longer you stay self-insured, can be very impactful. And it's definitely somewhere where it could be an initial investment, and sometimes it's not. Sometimes it provides immediate savings, but long-term stability and cost reduction is something that you'll see a greater impact when it comes to being self-insured. One thing we're doing locally, and this ties into a lot of our clients when it comes to wellness, is we're partnering with Northwell through their Northwell Direct program. For our self-insured clients, they can add a tier 1 network that allows their employees to not only use their Blue Cross Blue Shields or the larger BUCA type networks, but they can add in a Northwell program where employees can go to Northwell Health and use their health system and at a much reduced discount, and to the employer in the claims cost. And by doing that, we're able to offer incentives to employees to drive down their copays, their deductibles, and their co-insurance. And while we're doing that, we're engaging utilization, having employees use the plan more. From a wellness perspective, we can use the resources that Northwell brings in to help us, like having clinical teams talk to employees about during lunch and learns about different types of benefits or wellness initiatives that can be offered and how to get themselves healthier, and also offering, using their network at a lower discount a deeper discount, I should say, to drive down cost. So some of this I covered already, but through Northwell, the benefits that we're offering, we get direct contracting, we get cost savings, access to high quality care. And one thing, and the reason why I threw this in there, is through this relationship, we can have personalized care coordinators. So they get very involved with employees on a one-on-one basis. They'll have a resource that employees can talk to at any time in order to talk about their own health and their own health needs. And I think that's important. Having that kind of concierge type of service that can be baked into insurance plans definitely helps with supporting the employees' health needs. A little bit about recruiting. And so recruiting and wellness programs, it is definitely a certainty that these days employees and candidates are looking at your social media, they're looking at your websites. They want to know what type of employee perks you're providing, what type of wellness initiatives you're providing. So if you want to attract top talent, you need to be showing that you're engaged in these types of initiatives and that your employees are participating. And if you can show that on your social media, on your websites and your outbound communications, you're going to be able to have a competitive advantage in the recruiting standpoint in a market that's very challenging. It'll help reduce turnover. There was a study by the International Foundation of Employee Benefits that employers with effective wellness programs experience 25% lower turnover than without. And SHRM says that 60% of employees consider wellness programs crucial when they're deciding to select an employer. And as we've talked about, improved physical health leads to more productivity in the workplace, increased engagement, well-being. It all leads to reduced turnover. So, I think we've touched on everything we talked about in the beginning from an impact of why are you doing this? Well, if it's going to reduce my turnover or help reduce my turnover, it's going to allow me to have enhanced recruiting and lower health insurance or benefit costs and create more productivity in the workplace. That is going to lead to more success for your nonprofit. And as I hope I did a good enough job in exhibiting the impact of wellness initiatives, but also, because some of the things that we get are that my organization is too small for this. We don't have a big enough budget to do anything wellness related. And I hope I did a good enough job exhibiting that you can have wellness initiatives that can be for any size organizations and any budgets. They can be free. We had I was with an employer not too long ago at another presentation we did on wellness that was explaining how they went out in the community and they talked to local business owners and they were able to get local business owners to offer discounts to their employees. So one organization said they got a lot of their employees had older cars and they were having issues where employees were getting broken down. They were having flat tires or they were having issues with their motor issues and things like that. And they were having trouble getting to work at times. And so they went out and partnered with a local automotive mechanic and got a free estimate assessment. They were able to get a discount on the services. They were able to get some free oil changes and things like that thrown in, and an educational session about how to recognize these things so that it doesn't get out of control. And you wouldn't think of that as being something that fits to into wellness. But again, as I started, to think of this in an expansive view that all of these impact the well-being of an employee. If I'm constantly breaking down on the way to work and I have to bring my car into the shop, it costs me more money, right? Because I wasn't proactive. I didn't get to work. Maybe I lost money that day at work, or whatever that might be. That all impacts their well-being, and that well-being impacts their physical, their mental health, and certainly even their nutritional health. So I would say that if you could take one thing away from this, is that well-being is not just anymore, a gym membership. It's not just anymore an EAP program. It's everything that touches the employees' lives, like the work-life balance, flexible schedules, things like that. We mentioned. I'll also one employer made a partnership with a local discount wellness, like the vitamins and supplements, to allow their employees to go in there and get things that they needed in order to support their physical health. So a lot of things you can do. You can get really creative with this. You can go all in right away, or just be very, mindful about surveying your employees and finding what they're looking for. But again, don't discount the fact of the free stuff that goes along with your carriers that you work with already, the partners that you have relationship with in the community. All of that can go a long way in helping you get your program started. And so if you have any questions about that, feel free to reach out to us. Happy to answer any questions for any members of the Nonprofit Resource Hub or your friends. Happy to answer any questions about what we're seeing and how this can help for your organization. I believe we have it in the chat, but we have a couple of seminars that will be coming up. One is coming up on October 23rd. It is a webinar we'll be doing. We've gotten a lot of questions about weight loss and particularly about the GLP-1s and weight loss meds. So we decided to have a webinar about that, where we are partnering with Utopia Healthcare. Utopia Healthcare is a company, again, something else that you can provide to your employees at no cost. Utopia Wellcare partners with insurance companies to provide 6 nutritional visits a year to employees at no cost. Doesn't cost the employer anything, doesn't cost the employee anything. They do it under the provisions of the Affordable Care Act, which provides for preventive care at no cost. And so nutritional visits fit under that. They work with the insurance company, so we bring them into our client, our partners, and they offer that direct to the employees. They allow them to access Utopia Wellcare in order to get their nutritional visits, and they're free for the employee and the employer. So if you want information about that, happy to provide that to you so you can take that back to your organization. That to me is a no-brainer. It's something that most employers should be doing because it's another way to provide a resource to your employees at no cost. So on that note, just to finish my thought, we are partnering with Utopia Wellcare to provide this educational session on weight loss and the GLP-1s, and we're going to provide a lot of information and answer any questions you might have about it because it's a hot topic these days.
So Ed, thank you so much. That was a lot of information and a lot of really great information. I do hope that our guests today will take some time to let that digest and follow up with you with any questions. If you are for some reason unable to get in touch with Ed, please do reach out to us at the Resource Hub and we'll make sure we get you connected with him. Ed, I really appreciate your time and your knowledge as always. Thank you. And thank you for presenting today. And I don't know if you have any final thoughts, but I will leave that with you.
No, just thanks everyone for joining today. And I'll just echo again, as Allison said, if you have any questions, feel free to reach out. Happy to help anyone that's part of the hub.
All right. Thank you very much. And once again, if you're not yet a member of the hub, I do encourage you to register. It is free to join for nonprofits. So you can get on our listserv and you can hear about all the different things that we have going on. We have some really interesting things coming up. So you'll be hearing about them shortly. Thank you once again, Ed. And can you join the hub? You go to nonprofitresourcehub.org, become a nonprofit partner. So I hope that's helpful. If you go to our website, you'll see become a nonprofit partner. And please do follow up with Ed if you do have any additional questions. He is really great at helping you figure out what's best for your organization. So thanks again, everybody, and have a wonderful afternoon.
All right. Thanks, everyone.
Thanks, Ed.